Good morning, teacher. Our project is about acute coronary syndrome. Regarding the introduction of the project, ischemic heart disease is currently one of the most relevant pathologies, both in terms of mortality and loss of quality of life. It is known that this disease was present in ancient times. Signs of traumatic lesion have been found in human remains of Egyptian and Chinese civilizations. In the objectives of the project, we find the overall objective is describe the clinical behavior and evolution of acute coronary syndrome. The specific objectives are define the characteristics of acute coronary syndrome, identify the main symptoms of the disease, specify the treatment or choice of the ACS. In the theoretical framework, the characteristic of the ACS is defined as a set of clinical manifestations usually produced by the rupture of an atheromatous plaque. This determines the formation of an intracoronary thrombus causing the different clinical entities depending on the degree of stenosis that it causes in the lumen of the vessel, collateral circulation, etc. Acute coronary syndrome often causes discomfort or severe pain in the chest. It is a medical emergency that requires immediate diagnosis and care. The goals of treatment are to improve blood flow, treat complications, and prevent future problems. The signs and symptoms of acute coronary syndrome, which usually begin abruptly, include the following: pain or discomfort in the chest, which is usually described as mild and continuous pain, pressure or burning. Pain that radiates from the chest to the shoulders, back, neck, arms, or jaw. Vomiting, indigestion, breathing difficulty, excessive sweating, stunning, dizziness, or fainting. Although pain or discomfort in the chest is the most common symptom associated with acute coronary syndrome, the signs and symptoms can vary depending on age, sex, and other conditions.
Treatment. The immediate treatment goals are to relieve pain and distress, improve blood flow, and restore heart functions as quickly as possible. Long medicines, thrombolytics, nitroglycerin, beta blockers, angiotensin converting enzyme, ACE, angiotensin receptor antagonists, ARA, angiotensin. Conclusion. It is concluded that acute coronary syndrome owes to diverse causes, but it is recognized that the risk factors have a decisive importance in its appearance and or worsening once the cardiovascular event occurs. The great probability to continued